Happy Wednesday. A very warm welcome to tonight's broadcast with me, Gloria Mutesi. Starting us off tonight, this Wednesday at Urugwiro Village, President Paul Kagame chaired a cabinet meeting to discuss various issues, including the ongoing COVID-19 preventive measures. The meeting comes at the end of a localized 14-day lockdown for 50 sectors across the country due to the surging COVID-19 infections. The lockdown ended on Tuesday, but residents of those sectors had been asked to wait for the government to announce the next move. Meanwhile, news coming in, the statement on the cabinet resolutions reaching us indicates revised health measures which will take effect nationwide starting August the 12th, 2021, and I read. The cabinet approved resolutions of the previous meeting held on July 30th, 2021. The cabinet reviewed existing health measures to contain the spread of COVID-19, and the following measures will take effect nationwide starting August the 12th to September 1st, 2021. Movements are prohibited between 8 p.m. to 4 a.m. and all businesses must close by 7 p.m. I repeat, movements are prohibited between 8 p.m. to 4 a.m. and all businesses must close by 7 p.m. Public offices will continue with essential staff at no more than 50% capacity, while other employees continue working from home on a rotational basis. Private businesses will continue with essential staff at no more than 50% capacity, while other employees continue working from home on a rotational basis. Physical conferences will continue at a 30% of venue capacity, and all participants must present negative COVID-19 results. Public transport, e-buses, do not exceed 75% of the seating capacity, and bus operators will ensure that vehicle windows are open for ventilation and passengers maintain social distancing. Motors and bicycles are permitted to carry passengers and must strictly observe COVID-19 preventive measures. Restaurants shall resume at a 30% occupancy limit, and restaurants that offer outdoor seating service may operate at a 50% of venue capacity. All bars remain closed. Places of worship will resume with no more than 30% maximum occupancy. Arriving and departing passengers at Kigali International Airport must present a negative COVID-19 PCR test taken within 72 hours prior to departure and should comply with all the health guidelines. Tourism activities will continue in strict adherence with COVID-19 health guidelines, and this includes hotels, tour operators, transport services, and facilitating guests. RDB will provide the detailed guidelines. Individual and non-outdoor contact sport activities are permitted, and the Ministry of Sports will provide the detailed guidelines. Gyms and fitness centers will resume progressively, and the Ministry of Sports will provide the detailed guidelines. Civil, religious, and traditional marriage ceremonies shall resume but should not exceed 50 persons. Events held in licensed event venues should not exceed 30% of venue capacity, and all guests must possess negative COVID-19 test results taken within 72 hours before an event and are reminded to comply with the preventive measures, i.e. social distancing, hand washing, and wearing face masks. Attendance at a wake or vigil, ichirio, should not exceed 10 persons at any one time, and funeral gatherings should not exceed 20 persons. Gaming activities remain prohibited, and citizens are reminded of the critical importance of complying with health measures, including physical distancing, wearing face masks, and hand hygiene. Penalties will be applied for non-compliance. The cabinet was also briefed on a collaboration agreement between the Rwanda Development Board and the International Finance Corporation, IFC, for the development of a vaccine manufacturing plant in Rwanda. The cabinet also made the following appointments: Dr. Emile Bienvenu, the Director General, Rwanda Food and Drug Authority, done at Kigali, 11th August 2021, and signed by the Prime Minister, Dr. Edward Ngirente. Well, staying on the same note of COVID-19, Rwanda has launched a mobile vaccination campaign for elderly people going house to house in the city of Kigali, vaccinating people over the age of 60. The beneficiaries have welcomed this program, with some saying that they struggled to get to the nearby public hospitals to receive their jabs. Ethan Tashavia with the details.
Across the suburbs of the Kigali city, a special campaign to vaccinate elderly people over the age of 60 has been launched. The mobile vaccination campaign also targets pregnant women and those with disabilities that have not been able to go to public health facilities to receive their doses of COVID-19 vaccines. Health workers carrying mobile cooling boxes have been moving from house to house in Kigali to vaccinate such people. Some of those who have been vaccinated under this special program say they missed out on the usual vaccination campaign, while others were simply not able to move from their homes.
We would go to the health facilities and find long queues with so many people. I went there twice and could not get vaccinated. But still I needed the vaccine because it protects me from the severity of the virus. I was not able to go to the health facility. They phoned me home and I was vaccinated. I'm very happy.
Besides, there are some elderly people above 60 years who are still waiting for their turn to receive vaccination. I've not been vaccinated. Our local leader reassured me that we'll be invited for vaccination. I'm worried because if I contracted COVID-19 now, I would be in danger. Those who have been fully vaccinated are upbeat, saying they feel safe. We were fully vaccinated. It did not take long between the first and the second dose. We were educated about the benefits of being vaccinated. According to the Ministry of Health, 60% of the COVID-19 related fatalities in Rwanda include people aged 60 and above, and most of them had not been vaccinated. The Minister of State for Public Health, Dr. Tarsis Munga, says as more and more vaccines are made available, those who fall under vulnerable bracket will come first on the queue. There's a high level of participation in the vaccination campaign. Many Rwandans want to get vaccinated, including the young people. The problem we have now is that we have less vaccines. The goal is to find more vaccines, to vaccinate at least 60% of the population, and that requires many vaccines, some of which we've bought, while others were provided through the COVAX facility. If we got more in time, we'd vaccinate all people once and for all. Statistics from the Ministry of Health show that on Tuesday this week, out of 13 people who succumbed to COVID-19, 7 of them were over the age of 60. As of Tuesday this week, out of 911 people who died of COVID-19 related complications, include 210 between the ages of 60 and 69, while 167 people were between the age of 70 and 79, and 183 people were over the age of 80. Reporting for RwandaTV News, Ethan Tashabia.
Many thanks, Ethan Tashabia. Now, market vendors and people that work in other public areas across Kigali say they are worried about the people that gather in such congested places, as well and those who have turned such places into open bars. Jane Mutoni has the details.
Wumbogo Market, which operates every Wednesday and Saturday, has a high number of market vendors, and the people coming in the market mostly to drink alcohol in the surrounding bars. This has raised concerns among several people. It's hard to avoid getting infected when in this market, unless the number is reduced. And there are no youth volunteers to help us to stop more people from entering. We wish for authorities to send us youth volunteers to help us avoid getting infected or mitigate the spread. Our reporters spotted people that were drinking at a bar, which is contrary to the COVID-19 preventive guidelines. Upon seeing our camera, the offenders immediately took off. I came and found others drinking, so I joined, and I thought to myself maybe the COVID-19 restrictions have been eased. those that were checking their temperatures at the entrance and the ones that were serving them drinks in that bar had nothing to say. What is more worrying is that there are no youth volunteers at the Bumbogo market, apart from the public address system that passed through the area, reminding people to comply with the COVID-19 preventive guidelines. The head of this market, Maniraguha Jean d'Amour, says this is a problem. We are concerned, but as you have seen, there are some vacant places because we reduced the number of vendors working so that the rest can have enough space to work. But managing customers is still a problem because they have the right to come as they please. The same issue is in other public places where many people gather. The Bumbogo Sector Executive Secretary, Rugambi Rwadeo, says they are trying to solve the problem.
A
lot of people go to that market mostly on Wednesday and Saturday. Regardless, they should adhere to the COVID-19 prevention guidelines. Yes, there are many, but we ensure that there are washing facilities at the entrance, and we also have youth volunteers and security guards to ensure that people are maintaining social distancing. After our reporters at RBA left the market, youth volunteers were immediately sent there. The Minister of Local Government, Gatabazi Jean-Marie Vianney, warns the people and local authorities against violating COVID-19 prevention guidelines. People are still being caught going past curfew hours, others not wearing face masks properly, others attending birthday parties, gathering to drink alcohol. This kind of people are the ones causing problems because they could come from wherever they have gone infected and come home to infect others. Hence, we are reminding people that it is their responsibility to prevent themselves from getting infected with COVID-19 virus. The regulations established by the government sensitize people to avoid going to public places which are crowded and that markets should not exceed 50% capacity. Jane Mutoni, RTV News.
To other matters now, 100 days have passed since the current Secretary General of the East African Community, Dr. Peter Mathuki, took over office to serve a 5-year term. Dr. Peter Mathuki, who took oath of office at State House, Nairobi on February 27th, inherited the helm of the EAC Secretariat in the middle of the COVID-19 pandemic and at the time when member states were not fulfilling their financial obligations, among other issues. But how has Dr. Mathuki fared in the first 100 days in office as the EAC Secretary General? He spoke to my colleague Ethan Tashabia earlier today.
It's been 100 days. Probably one sentence, how would you describe your 100 days in office as the Secretary General of the East African Community?
Very exciting, inclusive, and appreciate the support that I've received from partner states.
What has been your main challenges, but also your biggest highlight towards regional integration?
Thank you very much for, again, hosting me. One of the things that is already said is that I came in at a time when the community is grappling with the COVID-19 pandemic, which has really affected lives and businesses across the region. That being a major challenge, it had really taken down some of the gains that the community had really, gained or taken on board over the time. But yes, here we are. It recorded a lot of, conversation, and that is why it was important that I consult with the partner states. If you recall very well, I had my first visit was in the Republic of Rwanda, where I met the government and indeed His Excellency, and really picked a lot of wisdom in terms of how they were expecting the community to proceed, and some of the issues that were very basic and important, and that helped me to really, deploy an approach that involves everyone in terms of trying to navigate through and ensure that again we resolve most of the problems that we are facing as a community. So the issue of inclusivity very important, playing a team very important, but also picking wisdom from partner states, very important. Way of dealing with resolving some of the issues. I'm happy to report that Most of the issues that face the community, different organs, are now resolved somehow to some extent, thanks to the support from partner states, thanks to different organs and different head of organs, both the Speaker of IALA, Honorable Martin Goga, and the Judge President, Nestor Kayobera, who agreed to work with me to see how we can, resolve most of the problems that were facing the community. And this was more around the inter-organ relationships. I'm happy that now the organs of the community are working in tandem toward the same vision and toward the same objectives of the community.
How far the journey has gone in admitting the Democratic Republic of Congo in the East African community? How far is the journey, and when do we expect them to join the regional bloc?
Indeed, this was a decision again by the heads of state summit that met on 27th of February 2021, and therefore directed the Secretariat to expedite the process. And I took up that as a priority when I assumed office. And I'm happy to report that we, did the launching of this mission with the President of the DRC, His Excellency Felix Tshisekedi. And immediately we sent a technical team to Kinshasa, who were able to meet with the team from DRC, and they were able to go through a number of issues for almost like 2 weeks. Thereafter, a report was done. I am happy to report that I have a report that is ready for consideration by the Council of Ministers. And then after the Council of Ministers, it will go to the heads of state summit for consideration, who will then decide the admission of DRC. Admission of any foreign state is a decision of the summit. So ultimately it will be the heads of states to make that decision. Mm-hmm. But we are making so far good progress because we have the report ready.
All right. And, there have been issues reported in the East African Secretariat, the issues of financing. If you could tell us what the situation is right now in regards to financing of the Secretariat itself, but also if you could as well tell us what should, how close have your tenure tried to bring the Secretariat and the bloc closer to the common people, the wananchi?
Indeed, it is in the spirit and in the treaty that the community belongs to the people, is people-centered. And when I did some consultation from the partner states by the heads of states themselves, they felt that we need to take the community more closer to the people by doing some continuous consultations, doing programs, creating awareness. And that is why we've been, if you see lately, now adopting the programs with both the organs of the community, like the court and the assembly, doing sessions at the partner states. So going forward, that is what we have agreed to do. But again, a lot of programs updating. We have a number of programs that we have updated, where the Secretariat is continuously engaging different ministries at the country level, so that we understand what are the issues that are prevailing or that are there between, and how we can resolve some of the problems, the challenges they're facing. And that is to say, we are not only operating from the Secretariat, but also we are engaging with the partner states to see how we can resolve different challenges that they're facing. Could be the ministries of trade, to see how to fast track the issue of a common external tariff, how to reduce the non-tariff barriers, what they expect us to do. If it is the ministries of agriculture, what are the issues in the agriculture ministry? How do we promote tourism? So these are consultations that are happening currently. And this is one way of taking the community to the people. Secondly, once out of this COVID, we will be having a number of programs, creating awareness across the partner states so that people understand what the community means for them. And this is what we intend to do. The issues of financing, yes, it is true, there are issues of financing that have been there over time. And this has been worsened by the fact that COVID came, and it came unawares, therefore a number of issues and delays in payments. But I can assure you, for the financial year that just ended, we have a number of partner states that have cleared all the balances. Maybe one or two still not cleared their balances. And in the new financial year, we're in the process of, talking to partner states so that they can make payments. Of course, we have gotten assurances that consultations are happening, and we expect to have resources ready to the community, and we continue implementing the activities. Thirdly, and more sustainably, we are developing a document that will provide for sustainable financing mechanism within the Secretariat. So that we don't only have contributions from the partner states, but we identify other sources that are more sustainable so that the community can remain properly, funded to ensure that, of course, activities and programs are undertaken on time.
Dr. Peter Mathuki, the Secretary General of the East African Community, many thanks for your time indeed.
Thank you.
Well, to social matters now, Gisagara district residents who received cows say that the cows they own changed their lives through providing milk for their children, hence solving the issue of malnutrition. Gisagara district set a goal to provide for each household a cow by 2022. Let's now hear from Ghislaine Mugwaneza.
100% of Kansi sector residents in Gisagara district own cows. They mention challenges they used to face before having cows. I was very poor before. Even though I don't have a plot of land, I can sell fertilizer at 4,000 to 6,000 Rwandan francs. It is expected that in 2022, all residents in Gisagara district will be having cows, which will boost agriculture sector in the area. The study conducted by the district authorities showed that 30% of the residents in Gisagara have no cows.
We eat and supply for markets from what we have harvested, and after getting money from what we sold, we invest it in other businesses and develop.
When we get milk, we sell it and be able to get books for children and other basic needs at home. You understand that life had changed. Gisagara district officials say the residents' collaboration by households with cows gifting neighbors without cows will help the district achieve the set target by 2022.
It's the collaboration from partners and from the residents, and the major one is the role of the officials in empowering others. We thank the officials that helped residents to achieve the goal, and that is why we encourage other residents to have courage and know that the goal is theirs and it's for their development.
Currently, 52% of Gisagara residents own cows, which was 30% in 2020. It is expected that in 2022, all households in Gisagara district will be owning cows.
The University of Rwanda says that through its partnership with the Kent State University in the United States, it hopes to make a significant contribution to students' research, which will be achieved through collaboration between the students from both universities. The Deputy Vice-Chancellor for Academic Affairs and Research for the University of Rwanda, Professor Nosar Egbo, says there are many technology-based courses that Rwandan university students will partner with the students in the United States.
Kent State University is a comprehensive university that has many areas of partnership. And there's quite a bit of areas of commonality between the University of Rwanda and Kent State University. And one area that we're going to start the partnership in is in the area of conflict, management and studies, which is already an established area in Rwanda. The other area is in, science and technology, communications technology, computer science and technology, the Internet of Things. This is one other area where Kent State University and the University of Rwanda can collaborate and really expand the capacity to work in that area.
Now, this partnership between the University of Rwanda and the Kent State University began in 2018 with Kent University Associate Provost for the Global Education, Dr. Marcelo Fantoni, saying the university will now send students to Rwanda who will come to learn, including the Rwandan culture.
Rwanda, because we needed to find a place in Africa that is safe for our students and that has a strong commitment in education. We want to have a center here. I really hope our university will be able to approve it. and we will have a permanent presence here with our students coming on a regular basis to study in Rwanda and to learn more about the culture of this